So today I will talk about physical activity and pollution in Hanoi. So to quickly introduce myself, I'm a French emergency physician. I also provide sport medicine consultation. I've been living and working for that hospital for now 7 years, so a bit longer than my colleague. And in the past, I worked in France, in Kinshasa, Africa, Saint-Pierre-et-Miquelon, close to Newfoundland, in Beijing for 4 years, a bit in Ho Chi Minh and in Hanoi. Because I lived in Beijing for a while, if you've been there before, you probably know that building. This is the headquarters of CCTV in Beijing on a very polluted day. And here you can see the Forbidden City entrance, if you can imagine it in the back of the picture. At that time, it was highly polluted in China, around 12 years ago. So you can see a clear difference between China, South Korea, and Japan. WHO, so the World Health Organization, stated at that time that the maximum AQI we could have would be 500. Thanks to my friend in China, we made it 1,000. Yeah, thanks. I'm talking about China, but we are all living in Hanoi, and of course we also have pollution in Hanoi. So talking about pollution means talking about air quality index. So the air quality index is made of different measurements, all of this, and each country decides how many pollutants they add in their index. You need at least 3. And the range and regulation and advice will clearly depend on the country. So you can see the range for Australia that are a bit different from the range for China. So that means we can't clearly compare AQI between different countries. And it's even a bit more complicated than this, because which AQI is displayed. What we do for AQI is we calculate one AQI for each pollutant, and we will display only the worst sub-index. That means for one identical AQI, you can have different level of pollution. For example, if PM 2.5, the first one, is very high, and AQI calculation is 500, you will have only 500 displayed, even if AQI for PM 10 is 100, 200, 300, or 400. We only take the higher value. So that makes things interesting to understand, because it's then difficult to compare the feeling and the level of pollution. The main effect on our health. So, of course, we have effect on our lungs, and a very interesting study started in California, prospective study with more than 12,000 kids, has shown that in children it reduces the lung function, and also it increases the risk for asthma, COPD, bronchitis, even during their adult life. Regarding the cardiovascular disease, it's very linked to inflammation and oxidative stress. And it seems that pollution increases the risk for calcification in arteries, and then increase the risk for strokes and myocardial infarction. Other studies have shown that if you live on a street with very high traffic nearby, you also increase your risk for lung cancer, breast cancer, colorectal, prostate, and lymphoma. And of course, it has neurological side effect. Pollution is a risk factor, not a 100% threat. It means you increase your risk if you are exposed to pollution, but that does not mean that you will be sick because you've been exposed to pollution. So to develop a cancer, you need different factors. Air pollution, good news and bad news. This article is very interesting because it shows us bad news, like exposure to fine particles contribute to respiratory cardiovascular disease, exactly what we said before. But probably the most interesting thing is even low exposure can cause health harm. But also there is a direct relationship between time, exposure to concentration, to the pollution, and the side effect. So if you have a longer exposure to pollution, you have a higher risk. If you have a longer exposure to a higher pollution, your risk is higher. So like Claude Bernard said, everything is poisonous, nothing is poisonous, it's all a matter of dose. To add a bit of drama to this, in 2019, WHO said that 99% of the world is living in a polluted area regarding the air quality. Yes. I also have good news for you, hopefully. The good news are if we reduce the air pollution, then we recover. Maybe not 100% recovery, but the lung recover, especially in children. And the public, we have a public health benefit if we increase the quality of air in our environment. In Vietnam, we can still find fresh air. So this picture was taken 2 weeks ago in Sapa during the Vietnam Mountain Marathon. I talk about pollution, and now I will talk about the benefits of having a physical activity. In our modern life, someone, a worker, will do 5,000 steps per day, so that's around 4 or 5 kilometers. If you are very active, you can go to 10,000 steps, around 8 kilometers. So if you take your car, elevator, and spend time on TV, so there is probably a way to improve your physical activity during the day. Also, WHO had some recommendation that we should have between 150 minutes per week to 350 minutes per week, depending on our condition, if you are pregnant, if you are an adult, and this recommendation has showed great benefits on our health. So recommendation from WHO. What kind of benefits do we have from this physical activity? Benefits for our heart. Stronger heart, it has an effect on the blood pressure. It has an effect also on your cholesterol level, so it can avoid taking a few medications. Also on our lungs, better volume, better endurance, less risk for infection if you have regular physical activity. For your muscles, your joints, and your bones, so better strength, better bone density. Doing activity, increase your balance, so that's a good point for when you will become older. Better balance, less risk for a fall. Less risk for diabetes, cancer, less weight, so less trauma on your joints, so only benefits. And also on the psych side, better sleep, better mood, less stress. So almost no interaction and no side effect for physical activity compared to swallowing pills. Yes, but you saw me coming. I talk about pollution, I talk about physical activity, and what should I do if it's polluted here outside in Hanoi? Should I go running, cycling, or just going out? So let's talk about it. So can you do it like this or not? There is a very interesting study from April this year that study replied to these specific questions. So very long study, it's a meta-analysis, almost 1.5 million people. They use all 8 different studies all over the world and prospective for 10 to 25 years. So that's a very good job. What they show us is that air pollution and no activity, you increase your risk of mortality by 36%. That's a lot. If you have some physical activity and no pollution, you decrease this time your risk by 31%. And in case of high pollution, then you decrease your risk by 26%. For sure, it's less than the 31, but it's still much better than air pollution and no activity. Okay, fine. You're going to tell me that's great, but what is the quantity of exercise? So if I do more exercise, you know that at rest we breathe around 5-6 liters per minute. If I do some exercise, I will breathe up to 90 liters, 100, 120 liters, depending on your body size and the exercise. So I have something for you. In case of low activity, we still decrease the risk of mortality by 19%. In case of moderate activity, 150 minutes to 300 minutes per week, 32%. In case of very high activity, it's a bit less, 30%, but still a lot more than doing nothing or having a low activity. So definitely, when you are exposed to air pollution, whatever the level of physical activity, you have a risk of mortality that is reduced compared to being inactive. Okay? Who benefits more? Women. Honestly, I don't have explanation for this. And next one is individual with high blood pressure. That probably means that doing physical activity and whatever you breathe in, the risk for your lungs, it outweighs the risk for your cardiovascular disease. Conclusion, keep moving, guys. Thank you very much.
Does anyone have any questions that they'd like to ask Dr. Prévost before he sits down and gets comfortable? Magnus.
I have a question. So you're saying that it's better to exercise moderately than exercise a lot in terms of reducing the risks?
Yes.
Do we know why?
Probably because of ventilation, I show you, if you breathe a lot, you will have more fine particles, so you will have more oxidative stress in your body, and that decrease a bit the benefits of the physical activity. Yeah.
Hmm. Yes.
But still, yes.
Yes. I saw that you mentioned there are many markers for the AQI. Is there a particular one that we should focus on more than the others in terms of mortality or going outside to exercise?
Probably the PM 2.5, because the particle is very, very small. So just go inside your body here and deep inside your body. 2.5 micron is very small. The size for a red blood cell is 7.5, so it means 3 times more than these particles. Something that was very interesting in China and even here when we talk about pollution. People will tell you, oh, today there is a lot of pollution, my eyes are itching, my throat, I feel uncomfortable with my throat, and usually it happens when we have PM10 or PM25 that is high, because these ones are irritating and they are usually blocked by our lungs, so they don't go deep. Compared to the PM2.5, finally just you breathe them, you don't feel anything, no symptoms. But probably the side effect will appear 10, 25 years later. But the study I show about kids, it's a very interesting one because it's a prospective study. It has been going on for 25 years now. They are still following people and they have more than 12,000 kids. So, yeah.
Interesting. Thank you.
And what do you think about masks?
It depends. Sorry. Personally, I no longer use a mask when I do physical exercise for 2 reasons. The surgical mask, it's leaking everywhere, so it's not preventing at all just breathing small particles. So you need a mask that fit completely and that could filter the PM2.5. If you do exercise, strong exercise, it is very difficult to breathe through a mask. when you have a 90 liters per minute of ventilation, your mask is sucked down when you when you breathe. So I don't use mask.
I have one more question, actually. I don't know if you have this information, but how comparable is living in a polluted environment to, say, smoking or vaping or something like that?
Probably that smoking and vaping is much more toxic than living in a polluted environment. But everything is a question of dose, quantity, and time of exposure. So when you smoke for 10 minutes, but you have a high dose. But if you spend all your life in a polluted environment, I'm not sure that you have a way to do a conversion between both.
That's what I wonder. It's a tricky thing.
Yeah, it's a tricky thing, yes.
Yeah. Okay. Any more questions, guys? No questions. Okay. Thank you so much, Dr. Phuong.
You're welcome.
Thank you. Fantastic. Okay.